Okay, thank you. So the agenda for today's session is pretty extensive. We're going to hear from a lot of different people in a range of different perspectives. And we're going to start off with a welcome from Paul Brewer in a few moments. We're going to then hear from Mike and Gavin, who have been supporting us with our latest phase of work. Then we've got three perspectives coming from different people in the sector who are using the standard in different ways. So we've got Toby and Dawn from local authority, Chris Thorpe bringing a third sector perspective, and Ian Singleton talking about a private sector perspective. We're then going to have a discussion panel where our panelists are going to be Ben Unsworth from Essex County Council. We're going to have Linda Vernon, who works for Lancashire and South Cumbria Integrated Care System, Adam Harris from PlaceCube, and that's going to be facilitated by my colleague in MHCLG, Sam Villis. That'll be around 11 o'clock, so really hope that you'll be able to stick around until then. I'm just going to tell you briefly a little bit about the Local Digital Collaboration Unit, for those of you who aren't familiar with our work. We're part of MHCLG. We support the development of digital capabilities in local government in the UK. We also provide funding and support for digital projects, and we bring people together to share ideas and knowledge in occasions like this and the other events that will be running across Digital Leaders Week. We're guided by the Local Digital Declaration, which hopefully you can see on the screen there. You've already had a chance to read through if you're not familiar with it. You can read more about that by going to our website, localdigital.gov.uk/declaration. There are currently over 200 councils and other organisations who have signed up to this. It's a statement of intent, so it's completely self-selecting, but it helps us to understand collectively how we might move towards a brighter, more digital savvy future. When people sign the declaration, especially staff in local government, you get access to free training courses. We've got a recent online training offer we've curated, which please do check out after this event if you're interested. There's a range of things there, from human-centered design to running agile projects that might be of interest. And you can also follow our funded projects via our website. So far, we've given out around £8 million in project funding. We've funded over 30 projects. So please go to this website to keep track of what we've already funded and look out for opportunities for further funding down the line. Can't promise anything yet, but please keep your eyes peeled as we go through the year. So without any further ado, I'll pass you over to Paul Brewer from Adur and Worthing. He is the Director of Digital Sustainability and Resources. And he's been supporting us heavily in leading this work on Open Referral UK, which is one of the projects that we've funded over the last 2 years through the Local Digital Fund. So Paul, over to you.
Thanks very much, Matt, and great to see so many people here. Really excited to be introducing Open Referral UK, which is now the national data standard for local community services. I think we've known for some time how vital referral and signposting into local community services is. It's a part of practice for many frontline staff, from social workers to probation officers, housing officers to GPs, job centre staff to social prescribers. And for example, social prescribing is a particularly important case, being part of the NHS long-term plan. Their link workers aim to connect people into community groups for practical and emotional support. And it's a really successful model, but requires a local data infrastructure to drive it efficiently. In all of the examples of frontline working I've mentioned, there's clearly a need for easy access to accurate and comprehensive information about local community services. OR UK is the culmination of work over several years to provide a solution to this problem through this national data standard. And today we're making a call for all parts of the public service system to move to adopt this critical data standard, and indeed to demand it from directory providers and software suppliers. The pandemic has shown us ever more starkly how vital it is that people are supported in community. With each local system using the data standard, national bodies like the NHS and the DWP will have efficient and effective ways to connect to reliable local community data. So we'll all be on 240 volts. We'll all be able to connect in efficiently. And we estimate that admin savings alone of at least 12 million. And with better referral and signposting made possible, just one person avoiding adult social care for an extra year would deliver 8.5 million of savings. So imagine that scaled up. It's been a real privilege to work with such highly dedicated colleagues, squeezing out some extra time to do this work over the last several years. And it's really exciting to arrive at this launch point. Really like to thank MHCLG and Matt for having had the foresight to patiently invest in this critical infrastructure, and to our designers at Snook, and particularly to Mike at Porism for his technical expertise and amazing dedication. So we're excited to launch the OR UK community website, which is designed to help build the community of OR UK users, provide guidance and support to projects, and showcase adoption case studies. And this launch is just the beginning. It's time to build a movement now for positive change and drive up adoption. We believe we will reach the tipping point with your involvement, where all public service organisations will expect local community service data to be OR UK compliant. So I hope each and every one of you will leave us today with a sense of becoming dedicated champions for this work, and we can work together to create this critical piece of data infrastructure, which will be there to help us all in times of need in our lives. I'll hand back to Matt.
Thank you, Paul. That's great. A really nice introduction there. And so now going to be passing over to Gavin Maguire and Mike Thacker. So Gavin is Head of Service Design from Snook, and Mike is a Systems Director at Porism. And they're going to be talking to you about the most recent funded phase of work and what they've done there to advance the kind of work that Paul's alluded to around building the community website and putting the right kind of infrastructure in place for driving the adoption of the standard going forwards.
Thanks very much, Matt. Let's see if you could talk amongst yourselves, all 88 of you, while I attempt to share my screen. How's that looking? Can you see it?
It's there.
It's good. Excellent. So over the next few minutes, Mike from Porism and I are going to talk a little bit about Open Referral UK's history and context, as well as sharing what we're delivering as part of the beta phase and this launch. The project was conducted by Snook and our partner Porism, along with this much wider team. And for those of you who don't know, Snook is a research, design, and digital agency working mainly in the public and third sectors. And in 2019, we conducted the initial discovery work related to the data standard. And Porism is a technology company working a lot with local government, and they've been instrumental, as Paul said, in developing development and early implementation of the standard. So what we're going to do in the next few minutes is take a quick look at what Open Referral UK is and does, where it came from, what we've done in this beta project, and what the lay of the land is going forward. And Mike and I are going to do a double act, and to show you what that looks like, I'm now going to hand over to Mike to give you some background on the standard.
Great, thanks, Gavin. So before Gavin talks about some of the resources we've delivered to help you implement the standard, let's just start with some basics as to what Open Referral UK is. Well, in a nutshell, it's a consistent way of recording and sharing information about services. By services, we mean what's typically called human services, so anything from care at home, bicycle maintenance, meditation, women's support group, you name it. By sharing, we mean putting information in a format and using transport structures such that it can be moved between computer systems and understood there. And by consistent, we mean applying a structure that everyone who uses it understands it in the same way. This picture shows some of the kind of information that the standard supports. Very little is mandated, but the more you store, the more powerful the data is for finding services in applications such as social prescribing, as Paul Brewer mentioned. And one goal of the standard is that when you search for services, your results are far more productive and far better targeted than a standard Google search. So why do we need that? Well, typically across councils, voluntary organisations, charities and the like, there are many different directories of services. Often in one organisation, there are multiple ones with different quality control mechanisms, and data tends not to be shared between them, either because of a lack of trust in their completeness or because there aren't the technical capabilities to share between directories. Now, councils and the NHS in particular want to encourage wider use of independent services, so they reduce reliance on the public sector, particularly in the sphere of health and social care. So if we can improve the quality of service data and refer people on to reliable third-party services, we're reducing that load on the public sector and potentially providing better targeted services to individuals. So the Open Referral UK standard has this goal of gathering information once about each service and sharing it for use in a multitude of other directories and service finder applications, both official applications and also things coming from innovators who have access to open data. The standard format means information can be consistently interpreted between different people, and service records can be checked for completeness and incrementally approved using tools and processes that we've documented. Data sharing means we're not constrained by physical boundaries. So, for example, somebody on the border between two councils doesn't have to look in two different places or indeed at multiple specialist directories to find the services that they're interested in. Typically, there's an old adage that when you have 12 different ways of structuring data and you come up with a standard, you introduce a 13th. That is certainly not what we're trying to do here. We're trying to build on prior work, and we're trying to converge prior standards rather than introduce something new. So if we look at the history of Open Referral UK, if we can move on, Gavin, a couple of slides. Back in 2014, Open Referral was devised in the UK, in the USA, and there's a wealth of experience there in applying the standard for referring people to services. Now, in 2017, the Local Government Association, in work led by their Tim Adams, piloted a standard for services for Lancashire and North Yorkshire. And Snook in 2019 looked both at Open Referral in the USA and at the LGA's work and produced a discovery report which looked at the business case for a standard and reviewed the existing work to date to see how it could be improved on. So when Tim Adams picked up in 2019 a DCMS sponsored project that the LGA managed to exchange information to address services that are aimed at alleviating loneliness, this was guided by the discovery work. And together with Paul Davidson from iStand UK, we looked at Open Referral UK and Open Referral, and we introduced some UK specific extensions and looked specifically at how the standard can be applied in a UK context. And then Blackburn, Elmbridge and Hull councils applied the standard as part of the loneliness project, and Bristol did the similar work in parallel. Following on from that, in Buckinghamshire, led by Ben Unsworth, an Open Community Alpha project applied the standard to a family information services directory. So all of this has led to the standard being well tested with some solid experience, which beta work led by Snook has picked up on this year in order to come up with resources that have been delivered through beta work, which Gavin will now describe.
Thanks, Mike. So as Mike said, what we're launching here today includes a lot of outputs from the beta project. Our goal with that was to develop the ecosystem needed to drive the adoption of the standard. And I'm going to talk you quickly through the process that we used and the outputs that it led to. One of the first things that we did was to identify the user groups which are most critical to the adoption of the standard. And these are distinct from the wider set of indirect users or beneficiaries of the standard who might play a less critical role in whether or not it's adopted, such as referrers or people receiving the actual services. But the groups we focused most on, therefore, were local authorities and their partners who commission service directories, software suppliers who build and supply directories and other tools, and national bodies who can help spread awareness and drive adoption of the standard. We worked with stakeholders from these groups to understand what the most important factors were for them on their journey to adoption, including potential hurdles and barriers. We were interested particularly in needs around adopting the standard, which are not quite the same as needs to be met by the standard once it is adopted. For example, for local authorities and their partners, key adoption needs include understanding how the standard can benefit the authority and a place, achieving buy-in from colleagues on adopting the standards, and knowing how to go about adopting it. Whereas for software suppliers, key needs around adoption include understanding how the standard will improve the product that they're building and receiving technical guidance on going about adopting the standard and validating that what they're building is compliant with the standard. And the key needs of national bodies around adoption of the standard are understanding how it can increase the quality of services data, which should lead to more targeted referrals and better outcomes for those in need of services, as we've been hearing, and also understanding how the standard should increase the visibility of services and their data with associated benefits, such as enabling more informed commissioning decisions. And there are some needs that are shared by all groups, such as being able to contact people with experience and understanding of the standard, and indeed having confidence in the standard. So we used these needs in order to arrive at three main areas of focus for the beta work. The first is an online presence to take people from awareness of the standard through its adoption. The second area is around communication and engagement. We made and tested various tools, including setting up a newsletter and creating a template, making it easy for people to submit case studies for the website. And the third area is around governance. We worked with our partners and other experts to propose a governance structure and governance principles and a roadmap for its implementation. But of these three areas, the focus of the beta work was on the online presence that we're excited to be launching today. And I'll quickly share a few highlights from it. Some of these as well include our attempts to meet the needs from the previous slide. So we built a website that explains what Open Referral UK is, both through text and a video, and it outlines the benefits to the key user groups I mentioned earlier, and it explains how the standard works. It features case studies from the different user groups. These are designed not only to reinforce the benefits, but also demonstrate how different kinds of organizations went about implementing the standard. And it also outlines the steps to adoption for different key audiences. There's also a link to tools and detailed information for developers. to help organizations adopt the standard and ensure that their data is compliant with the standard. And the website has several community features. It prominently lists organizations that are on the Open Referral UK journey, and this is intended to increase confidence by showing the growing user base as it grows, and also help organizations that might be able to help each other find and contact each other. And what's shown here is a taster list on the homepage, but it links through to a complete list of organizations, which is sorted by type of organization. And Mike's going to speak to this a little bit in a minute. Finally, other ways to engage that we've included are a forum on various topics through which people can help each other, a direct email contact link, and the ability to sign up for a newsletter to stay up to date as the standard develops. So after that whistle-stop tour of what we've done so far, I'm going to hand back to Mike to talk about what's happening now and next with the standard.
Thanks, Gavin. So where does that leave us? Well, we have that bunch of resources that Gavin has described, and if questions come up today that you don't feel are answered, do go on the online forum and pose them, and I and Gavin and all the people involved in implementing and using the standard will try and address them. We're building this community of self-help there through the forum. Gavin mentioned we've got case studies, so here's a selection of organisations who've implemented the directory and about whose implementations we have case studies. So, and they fall into four main categories. There are organisations who are responsible for commissioning service directories and ultimately the quality of those. So they include Buckinghamshire, Blackburn with Darwin, Elmbridge, Hull, and the Lancashire and Cumbria Integrated Care Partnership. We have suppliers whose products now support the standard, and we have case studies from FutureGov, PlaceCube and public partnerships on their compliant products and how they've implemented them with some of these councils and other organisations. We have people that use the outputs of those directories in service finder applications. So there are case studies from Doc&T and Vida, and I should emphasise that their service finders can be plugged into any standards compliant directory. So you can kind of do this mix and match. And one major feature of the standard is that we're getting away from you being tied in to one supplier. Any products that support the standard, you should relatively smoothly be able to swap between. Rather than see the tie-in to directories, which historically we have seen. And then finally, there's a case study from Wellaware, who've worked with Bristol in gathering service information and maintaining it according to a particular service level agreement. So we're separating out the delivery of a service directory, the service finder tools, of which you can have many from one directory, or indeed from an amalgamation of multiple directories, and the actual gathering and maintaining of data to high quality standards. And the website includes, as well as case studies, it includes tips on procuring these different types of service. So that's where we are now. And if we come on to the roadmap, we are at present and into the future providing an ongoing service which helps people implement the standard through online support mechanisms, and we're encouraging most dialogue through the forum rather than email, but email is there if there are things which aren't of general interest. We're taking feedback on any issues people have with the existing standard, so there can be a controlled upgrade path, hopefully with full backwards compliance. And we're increasingly sharing learning with the US community, and we're finding our interests are very similar, and they are indeed adopting some of the extensions that were added for UK purposes because they find them important over there. And importantly, we're talking more with sectors beyond local government, and the big benefits of the standard can be gained where you're joining up the same data across sectors. So we're looking at quite a fast growth path. Next, please, Gavin. With multiple organisations coming on board all the time. So PlaceCube and Public Partnerships are both talking to me about multiple new local authorities who are looking at adopting the standard, either existing clients or new clients for these providers. In a week or two, we'll have online a dashboard which tests live feeds of data and reports their degree of compliance with the standard. And there are other local digital funded projects which are applying the standard. Two in particular worth mentioning are the Local Gov Drupal product. Now this is a Drupal based CMS that's implemented by more than 30 councils, and the Local Gov Drupal project has a work stream to introduce to that product a services directory which will be compliant with Open Referral UK. And there's the Savvy project, Scalable Approach to Vulnerability via Operability. Essentially, this is concerned with proactively finding vulnerable people or families, referring them to appropriate services to address their vulnerability, and then measuring the results. So the middle part of that, the referral to services, uses Open Referral UK, and that product is testing the effectiveness of Open Referral UK within the whole Savvy model. We've been talking with NHS social prescribing people looking to set up standards in that area, and they have a draft procurement framework which requires the use of Open Referral UK in a social prescribing context. And finally, the standard is going through the formal GDS standards approval process, so it becomes an official government data service standard. So it's exciting times. So thank you very much for listening to Gavin and me, and I'll hand back to you now, Matt.
That's excellent. Thank you so much, Gavin and Mike. I put the links to the key resources in the chat there, so please do have a look. We'll share them again at the end of this call and in kind of subsequent follow-up emails. I hope it gives you a good sense of where we've got to in the most recent phase of work. But next, we're going to be hearing from a few people who've actually contributed case studies to the website. And we're going to start with a local authority perspective coming from Leeds, and in particular the Leeds Loop programme. And this is going to be shared with you by Dawn Kellet, who's project manager at the City Digital Partnerships team in Leeds, and her colleague Toby Page, who's a solution architect in the same team. Thank you. So I'll hand over to you.
I hope you can see the screen. Can you see the presentation okay? Great.
Yep.
Nods. Good morning, all. Yes, so Toby and I would like to give an overview of the Leeds Open Online Platform, or Loop as it's often known, and why we actually chose to use Open Referral UK standards. So initially Loop, actually with the vision for it, came from some discovery work where we surfaced obviously many data silos and actually the wealth of websites and directories in Leeds, all holding community service information and all having to duplicate, keeping that up to date. And also there was obviously a huge lack of a consistent data standard used across that landscape. So after some discovery work and an initial proof of concept, we have a number of third sector organisations and statutory organisations that are signed up to adopt Loop over a 12-month period. That also includes our application in Leeds for person held record, which is known as HELM. So it aligned to many of our strategies as well from a wider perspective. So the personalised care directive, obviously, which is national, and it's a huge focus here in Leeds, and specifically the supported self-management element of personalised care. Also asset-based community development, it aligned very much to that. So we have a number of organisations who have been signed up to this. Sorry, next slide, Toby.
I think it's on to me, isn't it, Dawn?
Yes.
Yes, I mean, from a practical perspective, as Dawn was saying, is in the middle here, we've got lots of organisations who wanting to take a feed from Loop, but essentially on the left here, we've got information providers entering data into an admin portal, effectively, which feeds a database, which is a kind of open referral based on the open referral standard. So these organisations in the middle, in the dotted box, have either websites representing third sector services or organisations, helms on there. So that's a person-held record for citizens to log into to manage their health. There's the Leeds directory is the statutory directory managed by Leeds City Council. And then we also got Mindwell on there, which is a mental health website providing information and services. So we kind of had this evolving proof of concept, if you like, which has become a kind of a community of people who are engaged with Loop, and they've all signed up to this community, the concept that they're going to maintain their listings of services in a consistent way using the standard. And then on the other side, there's various different people who would benefit from this information. So there's obviously citizens of Leeds will make use of these various websites, but then also we've got the professional side of things. So health professionals, we use it. We're looking at social prescribing kind of use cases, and primary care clinicians who would potentially use the data in here to signpost people more effectively based on their needs and problems. And then further along to the far side on the right, then we've got using that data by use of that data by commissioners and service managers. So we've had, this is kind of evolving requirement really, where people have seen this Loop evolve and say, well, this will be really useful for us to understand the coverage of certain service types or certain gaps in provision, and so there's an evolving requirement there, which we're gonna build some sort of research tools on top of Loop, which will allow them to understand that. So yeah, well, this arrow here is, so we have a different range of integration options, allowing people to embed, if you like, or render that information from Loop onto different websites in different ways according to their needs. So so when we came to well, the discovery, after following the discovery work, we very quickly came across Connected Kingston. So this is a directory that was built by a supplier in Leeds called AUP Digital, and so this was kind of led us into the open referral world in a way, because we reused a lot of the code base from Connected Kingston. We've extended it, but we have kind of sat on top of that work. So that was kind of a driver. But then we also kind of the statement around the second point here, directory of services that meet human needs, and this is kind of something that resonated with the needs of Loop that came out of the discovery work, and we want to make sure that this could be a way of standardizing, increasing trust. Trust was a big element of this, and also I think the key one really is around, as Mike mentioned earlier, is around systems integration, promoting that and promoting the targeting of services, or allowing people to find services in a more targeted way. Obviously, it gave us a good foundation for the data model, which is brilliant from a design perspective, and also a really good foundation for the taxonomy and how we tag things, how we tag services. Like I said, we've done extra things on top of. Yeah, so this is in terms of the taxonomy, we've done extra things. So along with the kind of more commonly used taxonomy areas, service types, circumstances, and needs, we've also added conditions as a taxonomy kind of branch based on the SNOMED CT terminology, and that's really to support the more clinical use cases for primary care and also from Helm. So in our person held record, we have the scenario where we might we've embedded Loop in the person held record. So if someone goes into their record and they have certain problems, the vision is that we would automatically signpost them via the tagging in Loop to relevant services. And there's a few other bits we've done. We've improved the UX around that for administrators. We've also kind of looking at this way that we keep things up to date by adding some data scoring for freshness and things like this. In terms of more benefits, from my perspective as an architect, the brilliant thing about these standards is it's kind of a sort of a no-brainer really. We get this real design confidence in how we make choices around how data is represented. It makes it, we're not forcing standards on people, we're not forcing our own standards on people. It's a recognized data standard, so that makes the conversations with these disparate directories a lot easier. I mean, obviously we break the vendor lock-in. We don't want to go anywhere near one of our city principles. You know, we don't want to get anywhere near vendor lock-in problems if we can help it. It helps us, like, you know, align those directories when we put them together. It just makes those conversations a lot easier. We get some great support from the Open Referral community, been really helpful. Had some great conversations with Mike and his colleagues around the little challenges, and then I think from our developers' perspective, they have somewhere they can go and ask questions around implementation. And we've seen this in more recent integrations where they've said that struggling with a certain concept, and the documentation is there and it answers it very well, and that's great. I've mentioned the taxonomy, the stakeholder, you know, they're very interested in how they tag things and how they collaborate on that tagging, and then coming together in that common taxonomy is really, really important. And then finally, it does help us when we talk to other people around national and also regional adoption. So we want to do things with NHS service finders to contribute loop data into those. Obviously, if that's based on a recognised national standard, that makes those conversations much easier. And also from the regional perspective, we're working with the Yorkshire Humber Care Record, which is one of the LICRA programs, about how we help to tie these directories into their shared care records. So it's really good for us.
Yes, so in terms of aspirations, just to the next slide. Yes, we've had a lot of interest in Loop. Obviously, we're starting with around 10 adopters in the first year, and obviously we're looking at the vision for year 2. As Toby's mentioned, the NHS Service Finder have shown an interest. We also want to expand on looking at it as a commissioning tool. I mentioned previously about the asset-based community development, and Commission has been able to see data that's central, that actually gives them analytics to support if there's any services missing in particular localities within Leeds, and also actually where people aren't finding information that they're searching for. Social prescribing is obviously a big focus in Leeds. We've got a central commissioned social prescribing service, which is actually third sector based, but we also have social prescribing roles within PCNs, which is also a focus. Primary care have shown a very much an interest in this, in terms of embedding Loop into clinical templates, and obviously, as Toby's mentioned, the use of SNOMED codes will support that, and then obviously personal health records. And we're also looking at a chatbot functionality, the conversational AI. So next slide.
I think we're yeah.
So yes, in terms of lessons and advice, what we've certainly focused on is the benefits per stakeholder group. So sort of very early days, we did a lot of workshops, and then also looked at the benefits per stakeholder, which have been vastly communicated and keep being updated. In terms of the business transformation side of things, one thing we have found, and we planned for obviously in advance, is the fact that it's very much a cultural change. So it's about data for good. It's about a collaborative approach to the data, making sure it's updated in the city. So instead of data curators or information managers keeping this data up to date in their separate in silos, it's about bringing those curators together, actually looking at business models that work for them, and just changing that mindset that collaborative approach to data updating. So what we actually did is we've got a curator group actually led by a community builder. So it's kind of a community builder role, looking at the business processes that also sit with this, and actually just making sure that we continue with that culture and address any concerns, so that we can continue with a coordinated investment. So in terms of other challenges, though, I think that there is also a change in commissioning that I think is required. So, for example, some of the performance measures for directories and websites, it's still come down to how many hits do you have per web, on your website. And obviously we're trying to change that mindset with commissioners, that it's about how many hits you get to curated content. So for example, an organization adopting Loop, they would very likely have more hits on their curated content, but it might mean that that changes the hits to their website because this data has been shared wider. So I think that's one of the challenges that we definitely need to be addressing. We've actually started to address, is just to support that culture. The commissioning has to be there to support that.
Okay, I think we're at the end. I don't know whether we're doing questions at the end or.
That's excellent. Thank you, Dawn, and thank you, Toby. I think time's a bit tight for questions right now. So if anyone that has direct questions to Toby and Dawn, please put them in the chat, and I hope that they'll be willing to answer them there. Also, remember, we do have the discussion forum, so if you think of something tomorrow that you really wish you'd ask them, then that's a place where you can go and post that kind of thing. So that takes us on to our next presenter, who is Chris Thorpe. He's Head of Technology at CAST, which is the Centre for the Advancement of Social Technologies. Chris, up to you.
Hello, I'm having some mild IT issues, so I might get you to present my slides if that's okay, Matt.
No problem.
Thank you. Sorry, not normally in Teams, and my computer's throwing a bit of a wobbler this morning. Hello everyone. So I'm Chris from CAST. So for those of you who don't know, if we can jump to the next slide, please. CAST is a charity that helps other charities build better digital services. We're part of an initiative called Catalyst, which is a sort of scale up of this work involving a very large number of agencies and charities and the lovely funders that you see along the bottom here. And there's lots of words on some of the slides, but don't worry, I'll be sharing the slide deck so that you can read along afterwards as well. Next slide, please. So I wanted to start with some things that we hear from charities. We did some research with charities about 2 years ago, and some of the consistent problems that came up were, and the stuff in colour at the top is what they said, and the stuff below is what we discovered when we worked a bit more with them, is that they had trouble attracting users to services. Next slide, please. And nobody seemed to really know what services they offered, and maybe that was partly because they didn't describe them in the way that people would want to look for them. They saw it as an SEO problem, but when we dug into it, we realised it wasn't. And the next slide, please. And what we realised through this and through talking to them was that they also had problems where, because people didn't really know what they did, sometimes they'd be matched with the wrong sorts of referrals. They'd get referrals that weren't appropriate for them. Next slide, please. And we were trying to work out what to do about these sort of particular bits of problem area that we had discovered through this research. And then we discovered this wonderful project, the Open Community Discovery Project, which is why we're all here today. And we thought, aha, we think that's it. So we've been happy to be involved presenting the charity perspective to the Open Community Group since then. And thanks to everyone for making us feel so welcome as part of this process. So we started thinking about open referral and what it meant for the charity sector. And we've been talking to the charity sector for about 1.5 years about this. And what we found is, we know this from other work, the charity sector doesn't really move very far unless you can give it an example of something out in the world that they can learn from. So next slide, please. So I bet you didn't expect me to be talking about show times for movies and things like this, but I wanted to give you an example of how we explain open standards and federated search to the charity sector, so that they can understand the power of open referral and they want to be far more behind it. And so the example we give is that when you want to go and see a film now, it's much better than in the days when I was growing up, where there was the yellow pages and you had to phone them. You can now go onto Google and it won't just tell you what films are out, it'll tell you where they are and when they're being shown, and will link you through to a map. Next slide, please. And this magic that happens is because all the cinemas publish in this open standard called Event. And as a result, Google can federate all of the data about all of these events, which are movie showings, into that lovely search box that they showed. Next slide, please. And Event is also a standard being used by Open Active, which is sort of a sibling standard to Open Referral in lots of ways, which is about how to find exercise classes and exercise groups near you. And some charities are already publishing in the Open Active standard. Next slide, please. But the cautionary tale we tell them about this is that if you're a cinema that doesn't publish an event, you won't be in that search box. And consequentially, if you're a charity that doesn't publish in the open referral standard about the services that you provide, at some point you won't be really so findable. So it sounds a bit existential, but if you're not publishing the appropriate data in the appropriate standard, do you exist anymore to a certain extent once these federated services and federated searches have really got a hold in the sector? Next slide, please. So when we talk to charities about this, they're quite excited. They're worried about the cautionary tale, and then we sort of ask them what their needs and concerns are that we might need to solve together for them. And the first one is that they find it really difficult to publish data. Lots of them aren't terribly technical, and they'd find it really hard to publish to a standard. Conversely, they all want to be in charge of their data. They all want to be in control of their data, because that way they feel that there would be less of these wasted referrals, and they can update it whenever they need to. But then the problem as well is that charities don't really have a standardized way about talking about the services they provide. So the charity sector is very fragmented, and because of competition for funding, charities tend to describe their services in more and more elaborate ways when really they're the same thing. So we've been looking at how to solve some of these. Next slide, please. So for the first two, about publishing data and being in control of their data, we've been developing a tool which I'm going to show you some screenshots of, the Alpha 4, which is based on distributed ledger technology that makes it really easy for charities to publish data to the standard and use it. And I'd like to thank Mike for being available to help our suppliers who are SICAR in the work we've done here. And I think we're getting pretty close to having data published in the standard. The second problem about them not having a standardized way to talk about the service that they provide, this is partly because of competition, as I mentioned earlier, but partly because they're scared of some of the really big complex taxonomies, such as SNOMED. And the charity sector is particularly bad at having data about what it does and how many organisations do the same thing. So we've been developing a multi-use taxonomy that we can use to capture this sort of data that charities can use to describe themselves, and we can then do the mapping to other appropriate taxonomies. So if I can have the next slide, please. So this is the alpha that we're working on. This is just the homepage of it. It's at referrals.thecatalyst.org.uk. It's not available for widespread testing at the moment, but will be probably in the next sort of 3 to 4 weeks. We're working through it with a cluster of charities at the moment. Next slide, please. And it's very simple. It basically allows you to search for charities, either geographically or by keywords and categories that would provide services that you want. You might think there's an odd thing here saying playlist. this is basically a placeholder name for something that we're getting the charities to decide the real name for at the moment through a lot of user research. But playlist, we all understand from things like Spotify, this gives an organisation the opportunity to curate their own directory from the services that are here, and that directory is also exportable as open data. Next slide, please. But it also gives them an easy to see, easy to read interface, so they can use the sort of like the catalogue as a web catalogue. And there are some really simple screens to make it easy to publish this data. One thing we've been working on is having different levels of API access, so that things like domestic abuse shelters and substance abuse organisations can hide their location for safeguarding reasons. And so far from the charities that we've got alpha testing is they're finding it really easy to input their data, and that makes it easier for them to publish it and keep it updated. Next slide, please. And this is a quick first look at the taxonomy that we've been working on with an agency called Reply. It matches very much the sort of standard of open referral in that the key models in it are around organisations and services. And what we're doing is creating really easy to fill in sort of phrases about your organisation and the service that you provide. We actually have a virtual fridge magnet poetry type way of creating records in the taxonomy, where you can pluck different words saying, you know, small, volunteer-led, housing and things like that to describe your charity, which makes it a lot more friendly for organisations to use. But then we've got more detail further down, which shows people how they might create services like that. One thing that the charity sector is getting better at doing is reusing and understanding how to take other organisations' services if they're sharing it, and making a service similar to that for themselves. So the taxonomy will help charities publish in the standard, but will also help us have an idea of what charities actually do. One other reason for the playlist function that I showed earlier is that we can actually understand which charities are onward referrals from an existing charity that a referral's been sent to. So we can start to build a bit of a better picture of this sort of network of referrals that goes on there. Next slide, please. So where are we going next with this piece of work? So the piece of work so far has been funded by the National Lottery. We're sort of talking to lots of funders about the next phase of the work, which will hopefully kick off later on this summer. But in the meanwhile, we're doing more alpha testing of the referrals product with charities, finding out where we need to make changes, where we need to improve things, and finding out what they want to call the playlist function. And working with them on a sort of member get member type model to get more charities publishing in the standard. We'll be doing lots more work with the taxonomy, getting more charities to describe themselves using it. We've already worked with over 50 charities so far who can describe their services using the taxonomy. So we've gone through 3 revisions, and we think we're in a good place with that. And what we really want to carry on doing is working with the lovely community here, working with local authorities and vendors and other suppliers about how we can use the data. So if the charities want to curate their own records, at some point what we need to understand is how to define these records as the canonical ones for those organisations and for those services, and then how those canonical records can be pulled into federated searches, pulled into other directories, so that the data only has to change in one place. From our research, the majority of sort of incorrect referrals are actually because the data is out of date. So a charity used to provide that service but no longer does. So we want to really work with the community to ensure that it becomes a living set of data rather than a historic snapshot. So next slide, please. So all that's left me to do is say thank you to everyone for all the work so far. It's been an absolute pleasure and an honour working with you all, and we hope to carry on doing that, bringing the sort of like the charity sector's needs and helping to make tools that will help them to keep the data updated. So my email address is here, and I'll share the slides after the presentation. Thanks very much for being my slide person, Matt.
Thank you, Chris, for that. I mean, it's such an important perspective, and obviously we are ourselves funding local councils to deliver work, but it's really important to understand local ecosystems and the whole range of charities that contribute to this. So yeah, we really appreciate your involvement and encourage your colleagues from the VCS sector to get more involved in the projects in the community going forwards. The next presentation we're moving on to is Ian Singleton, who works for Digital Gaps, who's going to talk to us a bit about his perspective coming from the private sector and having worked in a number of initiatives around the Open Referral Standard.
Okay, thanks, Matt. Can everybody see the slides and hear me?
Yep.
Okay, right. I'm conscious I've not got an awful lot of time. So my name is Ian Singleton. I work for Digital Gaps. I'm a digital catalyst. I literally have just under 10 minutes to give a private sector perspective. So I can only really raise awareness of things rather than go into any details. And I'm probably going to focus mostly on product developers, but hopefully this will be of interest to everybody. Just very quickly, Digital Gaps is a consultancy that helps public and third sector make better impact with digital. As far as Open Referral is concerned, then these are organisations shown here who we've been working with for Open Referral UK, and we've been working on that and before that with the LGA service standard probably for the last 5 or 6 years. I'm going to use some examples from Lancashire and South Cumbria's integrated care system, mainly because Linda Vernon is on the panel, so I'm setting her up nicely. So just quickly in the next 9 minutes, I'm hoping to go through the opportunities that Open Referral gives to product developers. I'm going to whiz through some of the benefits. I'm going to highlight some of those challenges and just give you what I think my next steps are. And as I say, there's a lot to say, so I'm going to be rattling through these, but hopefully it will give you an awareness, and then you can ask questions, get into the details. So, just to give the context again, I'm focusing on product developers, but there's obviously opportunities for the private sector here as integrators and for the project management side of this. Okay, into development opportunities. I've set out 4 areas. This is going to flow left to right to show the data flow of Open Referral. So the first one, opportunity to collect and maintain the data. Now, this is the area where most service directories currently have an offering, generally with a central team. We believe that Open Referral gives the opportunity for many different directories to work together rather than compete and overlap, so that they cover the various contexts and local geographies. And of course, Open Referral then allows them to aggregate that into a place-based repository. We also think there is opportunities to create more of a crowd to help with this work. It's a big lot of work there, so getting the service providers on board, the frontline workers are a big army, and then there's volunteers out there. They can all come together now, all contribute to collecting and maintaining that local service information. True, the existing service directors are going to have to change their data slightly to align with Open Referral UK, and I'll mention that a bit later. In Lancashire and South Cumbria, PlaceCube have developed specific software to collect and maintain Open Referral data. Compass eHub working to include the extra fields in their UI and creating an API to share the data. So it's all definitely possible. Okay, I'm moving on to the next area. This is around assurance of the data. This is a potential stumbling block for a lot of people, so we really need some innovation in here from our product developers. PlaceCube again have developed a dedicated assurance dashboard, so teams can take responsibility for assuring the data that is collected is correct and creating the very much needed trust for those who are actually going to consume it. Digital co-production have developed a translator to align with the Open Referral unique IDs so that people can choose whatever language they want to see the information in, and they're going to build an API so again that people can pull that data out with the open referral data. Digital co-production have also built a website widget, so getting those service providers on board, if they keep their data up to date, they can easily see it on their own website with no effort on their part. And Lancashire and Cumbria are now looking at an aggregator to bring all of that collection into and assured data into one digital catalogue. Moving on to the third area, and this is the big one for developers. If we've got all this data collected and we've assured it, then there's a lot of people that are going to be looking to consume this. I think Paul Brewer mentioned at the start, this is fundamental to social prescribing. And I know that Elemental and others are testing consuming open referral data in Lancashire and South Cumbria. Digital co-production have built a service finder for frontline workers, which was built on the original LGA demonstrator. Self-care is going to be massive. The public sector at the moment doesn't do enough to empower families and friends, a huge resource that I think we can tap into. The structured data set with the taxonomies is ideal for any suppliers of chatbots to get involved, taking advantage of the likes of Alexa and others. And of course, there's space there for the front end of the existing service directories and the referral applications to consume and not worry too much about collecting that data, but they can just consume assured data. And the final area is management information. Of course, once we've got all this data, then we can start to understand the sufficiency of the services that we have in the different local geographies and contexts. And again, this is another area that we want the innovative product developers. Then we should be able to understand the demand for these local services, which means that we can make much better decisions on which services are needing to be commissioned. So the bottom line there is there are a lot of opportunities for developers created by the Open Referral UK. Moving swiftly on, benefits. I'm going to rattle through these. We've already seen, certainly from the start from Paul, the demand is there, so don't worry too much. We know about the digital declaration, MHCLG are behind this, LGA are behind this, and I think NHS are behind this, so there is demand there. We've not touched a lot on the business case. Let me just assure you that there is a business case. There is work going on at the moment. You can certainly ask Linda Vernon about that from Lancashire and South Cumbria's point of view, so don't be deterred. The business case exists. Make the effort to be compliant. Mike has mentioned that the community and the forum, there is a tool for you to show that you are compliant and prove that. So definitely worth becoming compliant. This is the picture at the moment across the ICS in Lancashire. And just making that point, there are lots of opportunities for product developers, and the fact that we've got an open data standard just means that the whole thing should be interoperable. There is a richer data set. We aren't looking to signpost people to organisations. We're looking to signpost people to specific services, what's available at 2 o'clock on a Tuesday afternoon. So there is a richer data set for you can get your hands on. APIs already exist, already created. You can consume those APIs, and it means that these applications can be up and running quite quickly. And I've already met, or Mike's already mentioned about the community, so I encourage you to get involved in the community. That will be a big benefit to the developers. Quickly on to the challenges. I've only picked out 4. I'm going to rattle through these. The massive one, there's already existing data out there. Don't get too worried about that. Align it to Open Referral UK. As Mike said, this has not come from stage left. We've worked with what's already out there, so you should find that you're not far off. But obviously, people are going to have to change their UI. As I've mentioned, that it's a richer data set. This allows us to be far more personal. Let's not give people 2,000 services. Let's find 2 or 3 that are appropriate to their particular geography, their local needs, their circumstances. So understand all that richness of the data and make use of that in your application. It's been mentioned a couple of times, you will not escape the taxonomies. Wherever you turn, someone's got their own taxonomy, their own set of categories. What you need to do is focus on service type. That's the anchor in Open Referral UK. Understand what that is, and then simply link whatever taxonomy you've got to those particular service types. So that's relatively straightforward, and Lancashire have made good progress on that. And the last one that's always asked, I want other fields that are not in open referral. So don't forget that open referral is just a core set of data that we're actually using to share with people. By all means, collect as much information as you want locally for your own context. But I would say if you are collecting something you think it is useful to share, then post that onto the forum. Let's get other people giving their opinions on that, and then hopefully we can improve the standards as we go forward. Straight on to my next steps. They're obvious. I hope the developers get involved, get on the forum, start looking at your own data sets and start looking at those categories. If you're not a developer at the moment, you're a council or whatever, then let your developers know about the new website, get them on that. Obviously push them into the forum, but if anybody gets stuck, then there's your email address that you can always send that through. And I think I'm under my 10 minutes there.
Unbelievably well-timed presentation there, Ian. Thank you very much, and plenty of content that you've covered. So realise that might have been a lot for some people. We will be sharing the recording of this if you want to watch that back. And as Ian says, just get involved in the discussion forum if you have any questions. Ian's got a lot of experience, like many people in the team, of supporting multiple organisations to implement this work, and so there is that great community of support out there. We're now then moving on to the discussion panel, and I will pass you over immediately to my colleague Sam Villis to introduce the panel members. Sam works with me in the local digital collaboration unit. Sam.
Thanks, Matt. Can everybody hear me okay? Just check in first of all.
Yep.
Yeah, good. Okay, perfect. So we're just going to open up for a panel discussion now. I've seen the chat is really buzzing with lots of different views, and hopefully some of the speakers so far can start contributing to that conversation a little bit more. For now, we're going to have our chat. We'll be talking to Ben Unsworth, who is joining us from Essex County Council. Ben, and all of the speakers, would you mind just turning your cameras on for me? We're also talking with Adam Harris from PlaceCube and Linda Vernon from Lancashire and South Cumbria Integrated Care System. If you're all there and you wouldn't mind turning your cameras on, that would be perfect for me. I can't see anyone. So
hi folks, I'll make a noise that might make my picture pop up to the top.
Yay, there you are,
I'm
Ben.
here.
Thank you. Thank you. So without further ado, we're going to crack on because in the interest of time. So I'm going to start with a very wide open but hopefully interesting question for Linda, if you wouldn't mind weighing into this one first, which is, why is this important now? Why is Open Referral UK important for us now?
Thanks very much, Sam. And I suppose I'm speaking with a bit of a similar perspective.
Uh-oh, Linda, I think we've lost you.
Health and Care Partnership. Can you hear me? Can you hear me?
You disappeared
Am
for
I
a little
there?
while there.
Oh,
You are.
can you hear
You're
me
back
now?
Yeah, you're back now.
Can you hear me now?
Yep, we can hear you.
Okay, let me know if you can't. My Wi-Fi's been playing up a little bit today, sorry. So I was just saying that I'm coming from a very similar perspective to Dawn and Toby from Leeds, because we're working as an integrated health and care partnership, which is really setting a precedent for collaborative and joined up care and doing things once on behalf of a system where that's possible. So we're working quite closely with our voluntary charity and faith sector and social enterprise partners who've really sort of stepped up during the pandemic response, and it's become really evident how much support they provide for people in a health and care setting. And obviously that's relevant to social prescribing, which has been mentioned by almost all of the speakers today. And our approach to social prescribing is that it's everyone's business. It's not just social prescribing link workers, it's our third sector partners, it's our clinicians, and it's about us empowering the community to be able to self-refer themselves as well. So in order to do that, we need to to underpin it with accurate and up-to-date data. Ian was talking about the multiple directories of services that we've had in Lancs and South Cumbria. We know there's at least 400, there's probably more. Massive duplication of effort and cost. So of course the standards allow us to gather our data consistently, as Mike was mentioning, and particularly from a commissioning perspective, it allows us to trust and to share that data more reliably, and it gives our frontline practitioners trust in the services that they're referring people to. For us as well, it's really important because we're moving much more towards data being separated from the applications that we interrogate it with, so that the data is not held in silos, which is why open data is so important to us. And obviously that allows us then to surface the data via many different platforms at the front end, and that in turn promotes digital health innovation. And I think Ian referenced crowdsourcing of data. For us, that's another sort of big enabler, because it allows the crowd to give us as much data as they can, and us to make sure it's assured, and that reduces the overall costs and allows us to ensure that the data is more up to date. So from a health and care perspective, massively promoting our personalised care agenda, social prescribing, our population health agenda as well. So, we already have joined up data about the people that we support. And if we start to cross-reference that with a single version of the truth around services, we can start to make more intelligent and joint commissioning decisions across health and local government partners. Working towards integrating with a personal health record means that we can empower our people and our patients much more. We've mentioned support and social prescribing and supported self-management, but also digital inclusion. So it's being able to surface this data, because it's open data, via chatbot, so people can use Alexa. I have to be careful because she sometimes turns on when I speak. It just means that our patients and our public and our frontline staff are so much more supported and enabled. So massive support for us in terms of promoting prevention, early intervention, population health management, personalised care, and all of that in turn, as well as digital inclusion, means that we can reduce health inequalities, which is one of our biggest priorities.
Thank you so much, Linda. And I'm wondering as well whether, Ben, I've got a question coming your way in just a second, but I wondered if there's anything you wanted to add to Linda's comments there.
We've covered a lot of it, and some of the speakers earlier touched on some of the things that we certainly through the discovery and the kind of prototyping for this found were really important. So yeah, that. At the heart of this, kind of where all of this started, was with, I guess, a bit of a frustration really that people were not able to access, critical services in a local area that were perfect for them. For whatever reason, they would present to a local authority or to a health organisation with a set of needs that perhaps weren't meeting various kind of clinical thresholds, but through local, like almost tribal knowledge, that there's this group of people who meet, every second Tuesday, and you could go and kind of interact with them, and it will give you, perhaps not everything you need, but it will help set you on a path to kind of meeting a bunch of needs that you have, and that has always been the kind of guiding principle in all of this. Really, is how do we just make that work? Because in theory, it should be a relatively simple and straightforward thing to do, but we know in practice, once we started pulling at these threads, there's an awful lot that sits under how complicated it is for a small local organisation to be able to be, quickly matched with people with sets of presenting needs. So that's been at the heart of this, as I say. It's that how do we connect people to the services they need? How do we give people that early help, prevention? There's a lot of focus on that for the right reasons. It's better for residents, for people using services, get some access to things quicker, but it's also a lot cheaper as well. We perhaps don't have to go through the complex kind of assessment processes and kind of doing all those lengthy referrals that frustrate people when they don't need to. So yeah, that's been at the heart of all of this for sure.
Amazing, thank you, Ben. And that leads me really nicely into my next question, which is more about how you and Oxford are kind of finding moving into this kind of new way of working. What's it doing for your culture, and how is it changing the organisation?
Yeah, it's a fun question, this. So I've had the pleasure of working with a bunch of local authorities over recent years. So currently with Essex, previously with Buckinghamshire, prior to that with a whole bunch more. And everywhere I've worked, we've seen similar patterns, really, particularly around this kind of use of data, connecting people to local services, a proliferation of kind of little bits of technology dotted around pockets of the organisation. Some of which designed kind of okay, but a lot of which have never really stopped to consider user need and haven't been through the right kind of design cycles to make them as effective as they can be. So this, I guess where I'm going with this is it doesn't sit in isolation, this focus on data standards, data quality. It sits with some of the other stuff we're seeing in the sector at the moment around a general shift to a better understanding of user needs. We're starting to see more and more kind of user-centered design happening, not just in tech and digital and data, but happening across the kind of policy space as well. And in my world of kind of service transformation, that's looking at everything across business models, organization design, and digital services. But shifting to more agile, iterative, kind of building feedback loops in, thinking about all of the component parts of services. And this is really starting to come together. Things like local digital kind of funds have supported that, and a lot of the projects we've seen come off of that have helped have some of these bigger conversations. So I guess it's within that context. That's generally the shift I'm seeing, is a better appreciation of how user-centered design isn't a panacea at all, but seeing how it relates to some of the other methods for change in organisations. So as I say, in that context, this focus on what is actually quite a nerdy data standards project, being able to hook that into some of these other really important agendas and really important ways of thinking about change has been, for me, a bit of a shift. This is the first one I've kind of worked on where actually, we've been able to get into the weeds, thinking about the plumbing that underpins the service, while also looking out ahead at that massive policy agenda around early help and prevention across health and social care services, and being able to kind of tie those two worlds together through this big ambitious piece of work. Super encouraging, and it's a trend I hope kind of carries on.
That's amazing and so inspiring. And also, we are very much here for the nerds in this conversation, so that's all good. Thank you. I'm going to move on quickly to Adam, because Adam, you work with PlaceCube, and I'm wondering, so Ben's given us one example of how it's changing culture in his organisation, but you work with a number of different organisations. So I wondered if you could give us a bit of a perspective on what you're learning.
Yeah, no, that's right. Thanks. So we're very fortunate to work closely with a number of customers and partners over the last couple of years, including a number of people speaking or attending today's event. So we provide an open data platform that we call Open Place Directory. And just a little bit of context aligned with some of the presentations earlier, we enable crowdsourcing, community engagement, assurance and publishing of the local community services data. We've been working with Bristol City Council, Lancashire and South Cumbria ICS through Blackburn with Darwin, Linda and her team, also in partnership with Digital Gaps, and we spoke to Ian as he flew through his presentation earlier. Also North Lincolnshire and Elmbridge. I think some of the common themes that I think are worth flagging up during early engagement, there's often a degree of nervousness about implementing an externally led standard. Some of those concerns include the impact on autonomy locally and the additional burdens of compliance. Generally, people are quite quickly appeased by the degree of relevance of the data structure. So we go through that curve quite quickly. We talked about a number of people have talked about the Open Referral UK community. And I think our customers certainly are appeased knowing that they can have an influence on the direction of travel for the standard, as referred to by Mike and Gavin earlier as well. Ultimately, people are very enthusiastic about adopting the standard. They can see the benefits locally in terms of the data quality and the service user experience that brings, but also the national benefits that Paul was referring to in his intro at the beginning. I think the interoperability of data and technology, a few people have mentioned as well, is a real positive. So in reality, the standard isn't that burdensome. It doesn't have unnecessary demands. Mike's mentioned earlier that very little is actually mandated. And we've also been able to add our own extensions, including things like UPRN that don't currently sit within the standard, but there's an active conversation on the community at the moment in order to bring those kind of things in. So consistent nature of a data standard, our customers are all taking very different approaches in establishing their ecosystems. So if I just talk about Bristol quickly, Bristol have got a central assurance function commissioned to the Well Aware programme under the Care Forum. Centralisation provides a single responsible body which simplifies the management of a local assurance policy, which is aligned with the standard. So that makes things relatively easy for them. If we talk about North Lincolnshire, who we're also working with, this is a council-led project, partly funded by the CCG, very much focused on enablement as part of a wider digital front door objective. So ultimately, North Links want the voluntary sector to own the model to maximise the currency and accuracy of the data. It's recognised that that's not going to happen quickly, it's not going to happen overnight, and there's going to be a level of maturity required within the local ecosystem. But the decentralised model with virtual assurance teams relies on a well-defined local assurance policy and governance around that. In terms of the work that we're doing with Linda and her team in Lancashire and in partnership with Digital Gaps, focuses on evidencing the concept of compliant data from a single source, as Ian just talked us through, into multiple use case focused front ends. The benefit of the data standard here is the interoperability it enables between the different software systems. So three of our customers, three very different approaches, but all obviously using the same standard that we're talking about.
Lovely. Thank you very much, Adam. That's really useful. I have one final question, and I'm very conscious of time, but I'm going to throw it out there to whoever wants to answer it, which is when we talk about or we think about standards, we often think of them as being quite rigid and dissociated from the services that that they can help. So I was wondering, how can we, as we move forward, ensure that this standard remains useful and applicable for the kind of wider community? Does anyone have any thoughts on that? Ben? Yep.
Yeah, I'm happy to kick us off on this one. So hopefully not too clear an answer. We take the transcript of the chat from this session, and we can start there. This standard started with a really good understanding of user needs, and both the service users of things like these directories and these types of services, but also the folks who have to work with the data day in, day out. So we thought about the needs of developers who use the APIs. We thought about the needs of teams who curate this data in different places, and what their kind of day-to-day experience is. So we've tried to make sure we keep all of that in the mix through discovery, alpha, and into this beta phase. So it's been present throughout. Sessions like this, conversations like this, the forum on the new website are all ways that we want to keep engaging with folks involved in this community and make sure that we are constantly going back and testing an understanding of the different needs of folks who are working with this data. So we're pretty confident. We've baked it in hard from the start. We've made it an expectation that we keep coming back to and testing our assumptions against what we know about the different users here, and there are a lot of different users to kind of keep an eye on. So I'm sure there'll be points of conflict and we'll have to resolve those as a group, but that's I guess part of the fun.
Great, thank you, Ben. And Linda or Adam, do you have any comments that you want to add to that?
I think it's pretty much as Ben said. It's about what matters to you. What matters to you, whether you're a frontline clinician accessing data, or a social prescribing link worker, or someone who's putting data in and assuring the data, or indeed a member of the public who's trying to access data in a user-friendly way themselves. So for me, it always comes back to what matters to you.
Yeah, I would agree with that. I think that the forum that Ben's mentioned and has been mentioned a few times before is invaluable, and hopefully everyone will engage with that and we can keep the conversations going. I think the other thing for me is finding ways to measure the impact of all of the work that's going on and evidencing that impact, because I think that's going to be a propellant.
Yeah, that's great. Thank you, Adam. And again, leads me on really nicely to my final question for Ben, which is, what happens next, Ben?
Goodness, little question, hey. Yeah, so I guess the phase we're in now, and as you can see from a really super conversation we've had this morning. This is such a great way to start on a Monday. I could do this every week quite happily. We're in the kind of adoption and awareness raising phase right now. So there's been an awful lot of work to get to this point, which is the point at which I guess we're confident as a group of people working on this standard to really pop our head up and say, yeah, we've got it. We think this is a part of the answer. So there's some processes around that. There's a kind of formal process that started with the Data Standards Authority to say, we know there's a set of problems around working with this type of data, and we think this standard is a good answer to those problems. So it's going through the process of having others challenge our assumptions here to look at the detail under the standard, and to hopefully kind of move us through that process of getting it kind of government recommended, government mandated. We'll see kind of where it lands. But that's a super important one. Is how do we get waves from the DSA? How do we get to that point where we can have enough of a stamp of approval to give people that kind of confidence to move forward? Telling stories, we're in that phase too. So fortunately, we've had some early adopters who have stuck their heads out and tried. Done some work, they've launched some services, they're exploring with us what it really feels like to do this, and we're incredibly thankful to them. We always need in all these kinds of projects the folks who want to go first and to do that learning and share that back. Our hope is, and as Adam was just saying, as we start to show the value, as we start to talk about benefits in quite concrete and tangible ways, then our next wave of people who like to see others do it well before they jump on board, which is also a very viable way of doing projects. I thoroughly recommend that as an approach. They'll hop on and they'll say, yeah, we can see how this works. And we can play that into our conversations about procurement and our thinking about technology and our organizations. And that's how you start to kind of build this momentum. So as that grows, the other bit I guess we're thinking about as a group is what's the ongoing sustainable model around Open Referral UK as a data standard. We know, certainly from talking to our colleagues in the US, that you need a degree of infrastructure around this. You need people who are thinking about this, if not every day, at least regularly enough to kind of drive the community, to make the technical changes, to kind of improve and adapt this thing as it goes. Our colleagues in the US have lived quite a hand-to-mouth existence. They've been grabbing project funding here, there, and everywhere to do that. And while that is a model and it has proved kind of viable, it's quite stressful, I think, for the folks involved. So we'd like to look at how we might have something that is a little more, gives a little more confidence over the longer term, and perhaps lets us invest a little more in that. We don't know what that model is. We're going to be kind of doing the work to think about that at the moment. Yeah, sorry, I've just passive aggressively muted somebody. Apologies. So yeah, last little thing. We've kind of got colleagues who've been on the call. So people like Mike from Porism and others are here to support folks who are going through that adoption phase. So we've got a kind of some folks who are going to kind of keep an eye on how this stuff goes. We'll keep answering questions on the forum. We'll point people to the right advice and guidance as they're kind of working through some of that implementation stuff. And then, we'll as well look at how we make sure we align back to our colleagues in the US with the kind of origin standards. So something we're quite conscious of is not just creating a whole nother standard again. You all know the meme better than me. How do we make sure we contribute back into that loop so that we're able to kind of play back what we've learned and done and help kind of move the bigger conversation around standards in this space as well. So yeah, loads to do. Couldn't do it without all of the people on the call today. So thank you.
Lovely. Thank you, Ben. And thank you to everyone who's part of the panel. I'm conscious of time, so I'm going to hand straight back over to Matt.
Thank you, Sam. And thanks everyone for taking part in the panel. So thanks to Linda, to Sam for facilitating it, to Adam, and of course to Ben. Thanks additionally to everyone who's been attending. I know there's still a few of you on the call who've made it right through to the end. So we're really grateful for your interest and continuing support. I'm just going to reshare the links that I shared earlier. So within that link on the right hand side, and we will share the slide deck as well, which will have these links on it. We've got a link to the Open Referral website, to the community forum, to the Data Standards Authority Challenge, which is currently still live, for the email address if you want to make any direct inquiries to the team here. And then just last but not least, and appreciate some of you may have already left if you were doing a kind of data standards double header. We are running a series of events across Digital Leaders Week. The next one has actually already started. If you were planning to go there, please go. You can see everything else I'm going to talk about on the screen here. You might be interested in the skills session on agile working tomorrow, or joining us later in the week to hear more about our funded projects. Again, the link is in the chat there, where you can see all of the talks that we're going to be running. So all that remains for me to say is thanks to everyone again. Please let's not let the conversation finish here, but do jump over onto the discussion forum if you have any further questions. If there's anything that's unanswered in the chat, we're going to put them on there, or please do post them there yourselves, and we'll try to make sure that the right people are responding to those to give you the best chance of success in implementing this standard and supporting its work going forwards. So once again, thank you very much.
Bye.